Have you ever wondered why you feel so tired all the time, even after a good night's sleep? Or maybe you've noticed a strange lump on your body but dismissed it as nothing. These could be early warning signs of cancer, especially in older adults. In this video, we'll explore 8 common symptoms that you should never ignore. By understanding these signs and seeking medical attention promptly, you can potentially catch cancer early and improve your chances of successful treatment. Don't miss out on this vital information that could save your life. Before we begin, I would appreciate it if you like this video. You can help me continue to spread the old age lesson. If you haven't subscribed yet, I recommend you subscribe and turn on the bell so you don't miss any videos. If you like this video, please comment number 1. If you don't like it, comment number 0 to let me know so I can make a better video for you. Now let's get started. Number 1. Unexplained weight loss. Unintentional weight loss, especially when it occurs rapidly and without any changes in diet or exercise habits, can be a significant red flag that should not be ignored. While it may be tempting to attribute this weight loss to positive factors like a more active metabolism or a busy lifestyle, the reality is that sudden, unexplained weight loss can be a symptom of a serious underlying health issue. When the body starts shedding pounds without a clear cause, it may be struggling with more than just a temporary imbalance. This type of weight loss can be an early warning sign of several types of cancer, including those that affect the stomach, pancreas, or lungs. For instance, stomach cancer may cause a loss of appetite or difficulties in digesting food, leading to a decrease in caloric intake without the person even realizing it. Pancreatic cancer, which often goes undetected until it is quite advanced, can affect the body's ability to process nutrients, leading to weight loss even if the person is eating normally. Lung cancer can also manifest through unexplained weight loss. This occurs because cancer cells consume a lot of energy as they grow and spread, effectively stealing calories that would otherwise be used by the body for normal functions. Additionally, lung cancer can cause symptoms such as a persistent cough, shortness of breath, or chest pain, which might reduce a person's ability to maintain a normal eating routine, contributing further to weight loss. It's important to note that while unexplained weight loss can be an indication of cancer, it can also be related to other medical conditions such as thyroid disorders, diabetes, chronic infections, or gastrointestinal diseases. However, due to the potential severity of the underlying causes, unexplained weight loss warrants prompt medical evaluation. Early detection and diagnosis are critical, as they can lead to more effective treatment outcomes. Therefore, if you or someone you know is experiencing sudden weight loss without a clear reason, it's essential to consult a healthcare professional to rule out any serious conditions and to ensure appropriate care is received. Number 2. Persistent fatigue. Persistent fatigue is often an early but subtle sign that something might be wrong in the body, including the possibility of cancer. Unlike ordinary tiredness, which most people experience from time to time due to stress, lack of sleep, or physical exertion, this type of fatigue is unique in its severity and persistence. It doesn't go away with rest or sleep and can be so overwhelming that it interferes with daily activities, making it difficult to carry out even the simplest tasks like getting out of bed, cooking a meal, or going for a walk. This extreme exhaustion can feel as though your body is weighed down by an invisible burden, leaving you drained of energy without any apparent reason. It's not just physical, mental fatigue often accompanies it, leading to a foggy mind, difficulty concentrating, and a lack of motivation, which can further disrupt your daily life. The root cause of this cancer-related fatigue is multifaceted. When cancer develops, the body must work much harder to fight the disease. The immune system ramps up its efforts, releasing various substances that can affect energy levels. The cancer cells themselves can secrete chemicals that alter how the body produces and uses energy, leading to a state of chronic fatigue. Moreover, the cancer can disrupt the normal functioning of organs, leading to a cascade of effects that sap the body's strength and stamina. For instance, in cancers that cause internal bleeding, such as gastrointestinal cancers, there can be a slow but steady loss of blood, leading to anemia. Anemia is a condition where there aren't enough red blood cells to carry adequate oxygen to the body's tissues, resulting in a significant drop in energy levels and leaving you feeling exhausted all the time. Furthermore, cancers like leukemia or lymphoma, which affect the blood and bone marrow, directly impact the body's ability to produce healthy blood cells, leading to persistent fatigue as one of the primary symptoms. The body's energy is not just being used to fight off cancer cells, it's also struggling to cope with the effects of reduced blood cell production, leading to profound tiredness. Additionally, the psychological and emotional toll of having cancer or being in the early stages of an undiagnosed illness can contribute to this fatigue. The stress, anxiety, and uncertainty can drain your mental energy, compounding the physical exhaustion you feel. Sleep disturbances, which are common in cancer patients due to pain, discomfort, or anxiety, further exacerbate the feeling of fatigue, creating a vicious cycle that's hard to break. It's also worth noting that fatigue can be a side effect of the body's nutritional state. Cancer can cause changes in metabolism, leading to weight loss and muscle wasting, which further weaken the body and contribute to the overwhelming sense of tiredness. As the body's energy stores are depleted, fatigue becomes more pronounced, often leaving individuals feeling like they're constantly battling a flu-like state of weakness. Given the persistent nature of this fatigue, it's crucial not to dismiss it as simply a sign of getting older or being overworked. If you find that your fatigue is lingering for weeks or even months without any clear cause, it's important to consult a healthcare professional. Persistent fatigue, especially when accompanied by other subtle symptoms like unexplained weight loss, night sweats, or changes in appetite, should be thoroughly investigated to rule out any serious underlying conditions, including cancer. Early detection of cancer is key to successful treatment. Fatigue that doesn't go away with normal rest could be an important clue that your body is trying to fight something serious. By paying attention to these early warning signs and seeking prompt medical advice, you can ensure that any potential issues are caught and addressed as early as possible, improving your chances for a full and speedy recovery. If you are still watching this video and finding these lessons useful, please comment number 1 below to let me know that you're still watching this video with me. Thank you for your valuable time. Number 3. Pain or discomfort. Pain or discomfort in the body, especially when it is new, persistent, or unexplained, should never be ignored. While pain is a common experience and can result from a variety of causes, ranging from minor injuries to chronic conditions, it also serves as the body's alarm system, signaling that something might be wrong. Therefore, any pain or discomfort, particularly in areas of the body that aren't typically prone to such sensations, warrants thorough evaluation by a healthcare professional. One area of concern is pain that arises in the bones or joints. For instance, if you start to experience a dull, aching pain in your legs, arms, ribs, or spine that wasn't present before, and especially if this pain persists or intensifies over time, it could be indicative of something more serious. Bone cancer, although rare, is one potential cause of such pain. Unlike the occasional aches and pains that might come from physical exertion or aging, pain associated with bone cancer often doesn't subside with rest or conventional pain relief methods. It might start as mild discomfort but can escalate into a more severe, persistent pain that may disrupt sleep or daily activities. The pain might be localized or spread to other areas, and in some cases, the affected bone may become weakened or more susceptible to fractures even with minor trauma. Similarly, discomfort or pain in the abdomen, particularly in the upper right quadrant, could be a warning sign of liver cancer. The liver is a vital organ, responsible for numerous essential functions, including detoxifying harmful substances, storing energy, and producing bile to aid in digestion. When the liver is affected by cancer, it can become enlarged, leading to a sensation of fullness or a dull ache in the abdomen. This pain might radiate to the back or right shoulder blade, and may be accompanied by other symptoms such as bloating, nausea, or unexplained weight loss. Liver cancer might also cause jaundice, where the skin and eyes take on a yellowish tint due to the buildup of bilirubin, a substance normally processed by the liver. In advanced cases, the pain and discomfort may become more pronounced and could interfere with your ability to eat, sleep, or carry out daily tasks. Beyond bone and liver cancer, pain is a symptom that can be associated with many other types of cancer as well. For example, stomach cancer might present with persistent abdominal pain or discomfort that feels like indigestion or a constant gnawing sensation. Pancreatic cancer is another serious condition that can cause upper abdominal pain, often radiating to the back. This pain might worsen after eating or when lying down and could be accompanied by other symptoms such as jaundice, changes in stool color, or unintended weight loss. Cancers that spread metastasize to other parts of the body, including the bones, can cause significant and often debilitating pain. This metastatic pain might be sharp or throbbing, constant or intermittent, and it can significantly impact your quality of life. It's important to note that pain doesn't always present in the most obvious ways. Sometimes it can be subtle or mistaken for other less serious conditions like arthritis or muscle strain. That's why it's crucial to pay attention to your body and take note of any changes, no matter how minor they may seem. Early signs of cancer can be vague or easily attributed to more benign causes, but if you experience pain that is new, persistent, or worsening, it's essential to seek medical advice. A healthcare provider can assess your symptoms, perform necessary tests, and determine whether further investigation is needed. In addition to the physical aspects of pain, there is also the emotional and psychological toll that persistent discomfort can take on a person. Chronic pain can lead to anxiety, depression, and a decreased quality of life, which underscores the importance of addressing it as early as possible. Managing pain effectively is a crucial component of cancer care, not only to improve physical comfort but also to support emotional and mental well-being. Number 4. Changes in bowel or bladder habits. Significant and persistent changes in bowel or bladder habits can be an important warning sign that should not be ignored. When it comes to bowel movements, various alterations can occur, each potentially pointing to different underlying health issues. For instance, a sudden onset of constipation, where you find it difficult to pass stool or experience infrequent bowel movements, could be indicative of a blockage or a narrowing of the intestines, which might be caused by a growth or tumor in the colorectal area. On the other hand, frequent bouts of diarrhea, especially if they are not related to dietary changes or infections, could suggest inflammation or irritation in the colon, which can sometimes be linked to colorectal cancer. Another concerning symptom is the presence of blood in the stool. This can appear as bright red blood, indicating bleeding in the lower part of the digestive tract, or as darker, tarry stools, which might suggest bleeding higher up in the colon or rectum. Both types of bleeding are serious and require immediate medical attention, as they can be signs of colorectal cancer or other gastrointestinal disorders. Similarly, changes in urination patterns can also serve as an early warning sign of potential bladder or urinary tract cancers. If you notice that you are urinating more frequently than usual, especially if this is accompanied by an urgent need to urinate or feeling that your bladder is not fully emptying, it could indicate a problem with the bladder. Pain or a burning sensation during urination, as well as the presence of blood in the urine which may appear pink, red, or brown, are additional red flags. These symptoms could be caused by a bladder infection, but they could also be indicative of bladder cancer, particularly if they persist over time or worsen. It's important to monitor these changes closely and to seek medical advice if you experience any of these symptoms. Early detection and diagnosis are crucial in managing conditions like colorectal and bladder cancer, and addressing these symptoms promptly can lead to better outcomes and a higher likelihood of successful treatment. If you are still watching this video and finding these lessons useful, please comment number 2 below to let me know that you are still watching this video with me. Thank you for your valuable time. Number 5. Lumps or masses. Finding a new lump or mass in any part of your body can be alarming and should never be dismissed, as it could be an early indicator of a serious health condition, including various forms of cancer. Lumps or masses can develop in different areas such as the breasts, testicles, or lymph nodes, and understanding their potential implications is crucial for early detection and treatment. For women, a lump in the breast is often one of the most well-known warning signs of breast cancer. While not all breast lumps are cancerous, many are benign cysts or fibroadenomas. Any new lump that feels hard, irregular in shape, or is fixed to the tissue should be evaluated by a healthcare provider. It's important to pay attention to other changes as well, such as skin dimpling, nipple retraction, or unusual discharge, as these can also be signs of breast cancer. Regular self-examinations and mammograms are vital tools in the early detection of breast cancer, significantly increasing the chances of successful treatment. In men, the discovery of a lump in the testicles is particularly concerning and could be indicative of testicular cancer. Testicular lumps are often painless and can be easily overlooked, which is why regular self-examinations are essential. Testicular cancer is most commonly diagnosed in younger men, typically between the ages of 15 and 35, and early detection is key to effective treatment. If a lump is found, even if it's not accompanied by pain, it's critical to seek medical advice as soon as possible. Lymph nodes, which are small, bean-shaped glands located throughout the body, play a crucial role in the immune system by filtering harmful substances. Swollen lymph nodes, particularly those that are firm, rubbery, and persist for more than a couple of weeks, could be a sign of lymphoma, a type of cancer that affects the lymphatic system. Lymph nodes in areas such as the neck, armpits, or groin are commonly affected. While lymph nodes can swell due to infections or other benign causes, persistent or unexplained swelling should be thoroughly investigated by a healthcare provider. Lumps or masses in other areas of the body, such as the abdomen, arms, or legs, can also indicate different types of cancers or other serious health conditions. In any case, the discovery of a new lump or mass should prompt a visit to a healthcare professional for a detailed examination and possibly imaging tests, such as an ultrasound, mammogram, or MRI. Early detection is vital, as it can lead to earlier intervention, potentially stopping the progression of the disease and improving treatment outcomes. Ignoring or delaying a medical consultation for a newly discovered lump or mass can lead to more advanced stages of the disease, making treatment more challenging and less effective. Therefore, it's essential to be vigilant about any changes in your body and to seek prompt medical advice if you notice a new lump or mass. Number 6. Persistent cough or hoarseness. A persistent cough or hoarseness that lingers for weeks or even months without improvement can be a significant and concerning symptom, particularly when it comes to lung cancer. While many people might associate a lingering cough with a common cold, allergies, or even a chronic condition like asthma, it's crucial to recognize when a cough becomes more than just a nuisance. This type of cough is often dry and unproductive, but it can also produce mucus or phlegm. In more serious cases, the cough might be accompanied by blood or blood-tinged sputum, which is a red flag that should never be ignored. Even small amounts of blood in the cough can indicate an underlying issue within the lungs. potentially pointing to the presence of a tumor that's irritating the lung tissue or causing bleeding. Hoarseness, on the other hand, is a change in the voice that can result in a raspy, strained, or weak sound. While hoarseness is commonly associated with conditions like laryngitis or vocal strain, when it persists for an extended period, it can be a sign that something more serious is affecting the vocal cords or the nerves that control them. In the context of lung cancer, hoarseness may occur if a tumor is pressing on the nerve that controls the vocal cords, the recurrent laryngeal nerve, causing changes in the voice. The development of a persistent cough or hoarseness in lung cancer is often due to the irritation or obstruction caused by a growing tumor in the airways. As the tumor expands, it can block the normal flow of air, leading to coughing as the body tries to clear the obstruction. The cough might also be a reflex response to the irritation caused by the tumor on the sensitive lining of the respiratory tract. In some cases, a cough associated with lung cancer may be mistaken for a smoker's cough, especially in individuals with a history of smoking. This can be particularly dangerous because it may lead to a delay in seeking medical attention, under the assumption that the cough is simply a result of long-term smoking rather than a sign of something more serious. However, it's important to note that not all lung cancer patients have a history of smoking. Non-smokers can also develop lung cancer and experience similar symptoms. Furthermore, persistent cough or hoarseness can also be accompanied by other symptoms, such as shortness of breath, chest pain, or unexplained weight loss. These additional symptoms can provide further clues to the underlying cause and should prompt a thorough medical evaluation. Shortness of breath, for instance, may occur if the tumor is large enough to obstruct part of the lung, preventing it from expanding fully during breathing. Chest pain might arise from the tumor pressing on surrounding structures or invading the chest wall. Hoarseness, when associated with lung cancer, can sometimes be subtle at first, starting as a slight change in voice tone or strength. Over time, as the underlying condition progresses, the hoarseness can become more pronounced, making it difficult to speak clearly or project the voice. This can be particularly distressing for individuals who rely on their voice for work or communication. In some cases, a persistent cough or hoarseness may also be accompanied by a feeling of something being stuck in the throat, frequent throat clearing, or even difficulty swallowing, dysphagia. These symptoms can further complicate the diagnosis, as they might mimic other less serious conditions, such as gastroesophageal reflux disease, GERD, or chronic sinusitis. Given the seriousness of lung cancer, it's essential not to ignore these symptoms, especially if they persist for more than a few weeks. A medical evaluation, which may include imaging studies like a chest X-ray or CT scan, as well as sputum analysis and possibly a biopsy, and can help determine the cause of the symptoms and guide appropriate treatment. Early detection of lung cancer significantly improves the chances of successful treatment. Therefore, anyone experiencing a persistent cough, hoarseness, or any other related symptoms should seek medical advice as soon as possible. By paying attention to your body and acting on these warning signs, you increase the likelihood of catching potential problems early, when they are most treatable. If you are still watching this video and finding these lessons useful, please comment number 3 below to let me know that you are still watching this video with me. Thank you for your valuable time. Number 7. Skin changes. Observing changes in your skin, particularly in existing moles or the emergence of new ones, can be crucial in identifying potential skin cancer early. Skin cancer often manifests through noticeable alterations in the skin's appearance, and these changes can vary in their presentation. One significant indicator is the alteration in existing moles. For instance, a mole that changes in size, whether it grows larger or becomes asymmetrical, may be a cause for concern. Normal moles typically maintain a uniform size and shape over time. When a mole begins to expand or develops irregular edges, it could signal the presence of melanoma, a serious form of skin cancer. Changes in the shape of a mole are also important to note. Healthy moles usually have a symmetrical shape, with evenly rounded edges. If a mole becomes uneven or develops an irregular outline, this asymmetry can be an early sign of skin cancer. Melanoma often presents with asymmetrical moles that have edges that are not smooth but rather jagged or irregular. Color changes in a mole are another red flag. A mole that starts with a uniform color but begins to exhibit multiple colors or shades such as varying tones of brown, black, or even red should be examined. Skin cancers, including melanoma, can have a diverse range of colors within the same mole, reflecting changes in the pigment or the presence of abnormal cells. The appearance of new moles or growths on the skin can also be indicative of skin cancer, especially if these new moles have an unusual appearance or texture. New moles that are larger than the typical size of a pencil or razor, have an uneven surface, or are accompanied by itching, bleeding, or crusting, warrant further investigation. These characteristics can be symptomatic of various types of skin cancer, including melanoma, basal cell carcinoma, or squamous cell carcinoma. It is crucial to perform regular skin checks and consult a dermatologist if you notice any of these changes. Early detection through self-exams and professional evaluations can significantly improve the chances of successful treatment and management of skin cancer. Number 8. Fever or night sweats. Unexplained fevers or night sweats, even in the absence of other noticeable symptoms, should not be overlooked, as they can sometimes be indicative of serious underlying conditions, including cancer. While these symptoms are often associated with common infections or other non-cancerous issues, persistent or recurrent episodes can signal more serious health concerns, particularly when they occur without an obvious cause. Fevers, which are defined as a body temperature above the normal range of about 8.6 to 37 degrees, can be a natural response to infection, inflammation, or other health issues. However, when fevers are unexplained or persistent, especially if they recur frequently or are accompanied by other unusual symptoms, it is important to seek medical evaluation. In the context of cancer, fever can sometimes be a symptom of conditions such as lymphoma or leukemia. Lymphoma, a type of cancer that affects the lymphatic system, can present with fevers that are often referred to as intermittent fevers or cyclic fevers. These fevers may come and go without a clear infection or other cause, and might be accompanied by other symptoms such as swollen lymph nodes, unexplained weight loss, or itching. In some cases, these fevers can be quite persistent, occurring over weeks or months, and may be characterized by spikes in temperature that are difficult to explain. Leukemia, a cancer of the blood and bone marrow, can also cause recurrent or persistent fevers. These fevers may be due to the body's response to the abnormal proliferation of white blood cells or secondary infections related to a compromised immune system. Along with fevers, leukemia may present with other symptoms such as fatigue, easy bruising or bleeding, frequent infections, and bone pain. The presence of night sweats, excessive sweating during the night that soaks through clothing and bedding, can also be a symptom associated with leukemia or lymphoma. Night sweats can occur without an obvious explanation, and they might be accompanied by an ongoing feeling of warmth or discomfort during sleep. In addition to cancer, fevers and night sweats can be caused by a variety of other conditions, including autoimmune disorders, chronic infections, or hormonal imbalances. Nevertheless, the combination of persistent fevers and night sweats, especially if they occur without a clear cause or are accompanied by other symptoms such as unexplained weight loss, swollen lymph nodes, or significant changes in health, should prompt a thorough medical evaluation. It is crucial to remember that while these symptoms can be indicative of cancer, they are not definitive proof of it. Many other conditions can present with similar symptoms, and a healthcare professional is best equipped to provide a proper diagnosis. Early detection and diagnosis of cancer or any serious condition significantly enhance the chances of successful treatment and improved outcomes. Therefore, if you experience unexplained fevers or night sweats, or if these symptoms persist or worsen, do not hesitate to consult with your doctor. A comprehensive evaluation, including a detailed medical history, physical examination, and appropriate diagnostic tests, is essential to identify the underlying cause and initiate timely treatment. In summary, while fever and night sweats are common symptoms and can often be attributed to less serious conditions, persistent or unexplained occurrences warrant professional medical attention. Early diagnosis is a key factor in effectively managing cancer and other serious health conditions, so seeking medical advice promptly is crucial for ensuring the best possible outcome. So, what have you learned today about the early warning signs of cancer in older adults? Hopefully, you now have a better understanding of the importance of paying attention to your body and seeking medical advice when something feels off. Comment below what is one thing you learned from this video that you will put into practice in your daily life. If you found this video helpful, please leave a comment, like, share, and subscribe to our YouTube channel for more health tips and information.